You're not feeling well, you've been sick, you've been coughing, you're having fevers, chills, body aches. You think you may have gotten something from somebody else. You may be having a UTI. You just don't feel right. You've been trying to get in to see your doctor, they're not available, so you decide to go to an urgent care clinic or the emergency department. And the diagnosis that you receive there is sepsis. Hi, I'm Dr. Nazneen Jamal. I am board certified in internal medicine and I practice as a hospitalist. My goal is to empower you and your loved ones in identifying and understanding what these diseases are that get you into the hospital and how we take care of them as doctors. So sepsis, what is it? Sepsis is a disease and it's more than just a basic infection. It can be caused by an infection. So what happens is you first initially develop an infection in any body part. In the bladder, it's often called a UTI. Infections in the lungs are most commonly pneumonia. If it's your skin, we call it cellulitis. And additional infections in other parts of the body also have their own types. But what's different with sepsis is that rather than being treated with antibiotics alone and being taken care of, sepsis is basically an entire disease process that has worsened. It is when the infection has spread to involve the entire body and the patient has more severe symptoms. We're concerned about sepsis. We need to identify it early because the mortality or risk of dying from sepsis is high. If you're identified with sepsis in the hospital, your mortality risk is often reduced because we can treat it and identify it earlier. So what will a doctor do? When you're in the emergency department and you're telling the doctor your story, they're also going to ask you a series of questions. In addition to that, they will check your vitals. Think about blood pressure, heart rate, temperature, respiratory rate or your rate of breaths per minute, and then your oxygen level, which we lovingly call oxygen saturations. In addition to that, they're going to check a series of blood tests. Think about your white blood cells, red blood cells, platelets, your sodium, your potassium, your kidney function, your liver function. They may check lactate. They may or may not check a urine test. They'll check a chest x-ray, maybe even an EKG. And they take all of that to decide whether or not you have sepsis. And if they decide that you have sepsis, you will be admitted to the hospital and you will likely be taken care of by a hospitalist. You're going to get IV antibiotics and additional fluids. Pay attention to my next video discussing in depth what kinds of medicines and treatments we use for sepsis.